Knock, knock. Hello, Celia. My name is Amber, and I am going to be doing some assessments relating to some preeclampsia assessment to check for any kind of seizure activity. And so what I'd like you to do is, first I'm going to check some cranial nerves. So I want you to occlude or cover one nostril and breathe out the other, and then do the other one. Make sure you can breathe okay. And then I want you to go ahead and smell this.
Baby powder?
Yep. Okay, so that is the olfactory nerve, nerve 1. Next we're going to do nerves 3, 4, and 6, which is the oculomotor, trochlear, and abducens nerves. This is going to check for eye movement. So what I'd like you to do, I'm going to look and see we don't have any drooping eyelids. Next I'm going to do 6 cardinal gazes with light and accommodation. So what I'd like you to do is keep your head straight. Just move your eyes. Okay, now just keep looking at me, and I'm going to come in from the side with a light. Okay. Okay. And so that actually checks nerves 3, 4, and 6. So next I'm going to do nerves 5 and 7, which are the trigeminal nerve and the facial nerve, which is going to check for facial movements. So I'd like you to go ahead and raise your eyebrows for me, okay? And scrunch them together, okay? She blinked too, so we have equal blinkings or symmetrical blinking. And I'm going to give me a big smile with teeth, okay, and without teeth, all right. And then puff your cheeks, and then purse your lips. Good. Let's see. Now I'm going to come in from the side. Just close your eyes for me real quick, and I want you to tell me if this is sharp or dull.
Sharp.
Okay.
Dull.
All right.
Sharp. Dull.
Okay, cool. And then one more thing, I want you to close your eyes again.
That tickles.
Okay, so light touch, sharp and dull, and those check the nerves 5 and 7. Next, we're gonna do nerve 9. No, I'm sorry, nerve 10, which is the vagus nerve. So for that, I'm going to check your gag reflex. So I'm not really gonna do this. We're gonna put this. We're gonna have our patient say ah. We're gonna put this in there and try to trigger the gag reflex. Good. If they can gag, then this indicates that they can swallow efficiently. And we're watching, and also watching for a rise in the soft palate symmetrically, and then uvula should be midline. So that tests actually the motor function in your mouth, so for swallowing and gagging. And then we're going to do nerve number 11, which is the accessory nerve. So for that one, I'm going to have you shrug against my hands. Good. Now push against my hand with your face, and again. Okay. And that tests like 8 nerves. And then okay, so then we're going to do some patient teaching. Oh, actually, next I'm going to do the deep tendon reflex. So what I need you to do is just stay right where you are for now, and I'm going to test your patellar tendon. All right, cool. Now I'm going to test your brachial tendon. So I want you to just lay your arm, palm up, just right in your lap there. I'm going to see if we're gonna do like that. I think I saw a twitch. I'm gonna try one more time. Hold on, let me see. Let me come around this side. Okay. All right, I think we got a little twitch there. So if those are working, that indicates good deep tendon reflexes and no hyperactive reflexes is what we're looking for. Next, I'm going to have you actually lay back And I'm going to take off some of your shoes here so I can
do that.
Yeah. All right. So just lay down all the way and just relax. I'm going to have you relax like a noodle. And just good. So we're not getting any beats of clonus, which is something we look for to find nervous system irritability, CNS irritability. So I'd like to go over some things that we're going to be doing for you while you're in the hospital. Because you have preeclampsia, this puts you at risk for seizure. So we're going to have to do some seizure precautions. We're going to have to take some seizure precautions. That's going to include things like right now we have the bed rails are up and padded. We're going to keep the bed low. We're probably going to keep the lights as dim as possible, and we would really need you to limit your visitors, to keep your sensory stimulus as minimal. We want you to just be as relaxed as possible, so that your CNS, your central nervous system's not so irritable. The doctor may put you on something called magnesium sulfate, which is a medication that will help prevent or treat seizures. In this case, we're hoping to prevent that. It does that by relaxing the irritability in the central nervous system. We're going to, get lights dim, and then some assessments and labs that we're gonna have to focus on. You can expect us to be taking some blood samples. We're going to have to keep track of any medications, especially magnesium sulfate. We're going to want to track those levels. We're going to want to keep track of your kidney and your liver health, actually. Sometimes preeclampsia can be hard on your kidneys and your liver, so we're going to be taking regular blood samples to track platelets, liver, and kidney function. We're going to probably have to give you a catheter, so we would be taking urine samples from the catheter to check for protein in your urine. You might expect to have a fetal heart rate monitor for continuous fetal heart rate monitoring, just to keep track of your baby's well-being. The doctor might even order an ultrasound to check for growth and fluid levels, amniotic fluid levels, and let's see. And I think that's it.
Have you done my presentation for seizures?
For seizure precautions or for
Precautions.
Yeah, the precautions was padding the bed rails, keeping the bed low, keeping the rails up. Oh yeah, we're gonna keep suction and oxygen equipment tested and ready to go just in case we need it. After a seizure, you might need that if that does happen. So we'll keep those at the head of the bed, and it's not here, but that would be here in a hospital room. Let's see. And then that was also part of the limiting visitors, dimming the lights, and padding the rails and all that stuff. And then I think that's it.
All right, and my call it's right here.
Oh, you can also expect us to be bugging you a lot to get your blood pressure. We need to track your blood pressure regularly. We'll be getting all your vitals regular, but especially important to track that blood pressure. And also, before I leave, I want you to report any changes in your headache symptoms, if there's any change in edema, if there's any changes in abdominal pain. Just make sure and report those to us so we can track any changes that are going on there and address them. And that is seizure assessments, labs, and protocol.